Our guest first appeared on this podcast many years ago, before the pandemic. She is a public health professional, educator, civic leader, podcaster, and author who has spent over 20 years providing tools and strategies to stakeholders, community-based organizations, students, and residents to improve health and prevent disease in some of Southern California's most underserved communities. You're listening to the PHEC podcast, episode 408. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Do you know that we've launched an app for this podcast? Well, when we celebrated our 400th episode milestone, I knew it was time for something new and different, so we made the decision and the investment in creating what so many have asked for, which is a community, a special community without the distraction of social media or ads. The PHEC podcast community is an interactive digital space where public health professionals connect and collaborate, even rest and relax and grow beyond the weekly podcast episodes. In this community, you're able to join a global network of public health practitioners and share insights, resources, and opportunities in a very focused and safe and healthy environment that's free of social media distractions. Now, we are very social in this environment, but we don't have the distractions of your social media feed. So experience deeper connections and conversations and get access to industry leaders and meaningful professional relationships that elevate your public health journey. Visit phecpodcastcommunity.com to join, or you can download the app in Apple or Google Play Store. The links will be provided in the description of this episode and also on the show notes page as well. I'm really excited to introduce you to our guest on this episode. She's been a guest on this podcast about 6 years ago, before the pandemic, which feels like even longer, right? But this was back in episode 146 that she appeared. And this episode that we're recording right now is episode 408. So you do the math. That's a long time. There's just so much has changed just with all of us. But she joins to catch us up. And it's just always to get these sort of updates and hear how so much has changed across the journey. We'll certainly connect you with the previous episode so that you can hear that as well if you'd like to go back and hear that one and then, listen to the current one as well. Whatever works for you. But let me formally introduce her now, and then I'll connect our conversation. Dr. Nicole Vick is a public health professional, educator, civic leader, podcaster, and author who has spent over 20 years providing tools and strategies to stakeholders, community-based organizations, students, and residents to improve health and prevent disease in some of Southern California's most underserved communities. Her commitment to community has led to a few prestigious appointments. She serves on the boards of 4 public health social service organizations and for 2 years chaired the Health Commission for the City of Los Angeles. Dr. Vick has 15 years of teaching experience and enjoys bringing students the Black girl magic version of public health while providing them with a social justice lens to view the world. She has taught at Occidental College, California State University, Ashford University, and University of Phoenix. Dr. Vick has a bachelor's degree in public policy management, a master's degree in public health, and a doctorate in organizational change and leadership from the University of Southern California. Dr. Vick has authored 2 books and has written chapters for 2 anthologies. In her first book, Pushing Through, Finding the Light in Every Lesson, she shares both the heartbreaking pain and the extraordinary triumph that led her to advocacy and social justice work. Dr. Vick also has a weekly video podcast where she discusses critical issues in the Black community from a public health and social justice perspective. Let's connect my conversation with Dr. Vick right now. Well, hello, my good friend, Nicole. Welcome back to the podcast. How are you doing?
I am doing so well. I just want to say it's so good to see you. I see you on LinkedIn doing your thing, but it's really good to see you and be able to sit and chat with you. So I'm really excited.
Oh my goodness. I feel the same way. I feel like, we've been cutting up a little bit before I hit record, but it is so nice to reconnect with an old friend. And we're going to get into the whole conversation detail. I mean, we've got some stuff to talk about, but just reflecting back, it's funny how our memories are not really, telling us the truth sometimes. We didn't think it had been as long as it had been since you were on the podcast, but it was. Now I've got to look up the exact date, but I'm thinking it was somewhere maybe in 2019,
And
end of 2019, maybe the beginning of 2020, but it was before your book came out, the first one.
and that is so crazy to me because it's COVID made time feel so weird. So in one respect, 2019 feels like yesterday, but at the same time, it wasn't yesterday, right? It's just so
Exactly.
weird. And so much has happened. So much has happened to me personally.
I know. Some really good stuff and some not so good stuff. But I'm glad you're here. So that previous episode was 146. So I'm going to make sure I'm going to look up some dates and all of that by the time we put this episode all together and it's released. I'll be able to share with the listeners, both this episode they can listen to and connect them to the previous one and your books and all of that good stuff. So no worries about that. And I'm going to do a little fact finding and figure out the date because I'm curious about the date. So
Right?
but without any further ado, let's dive in because we got some good stuff to talk about. And just for the record, for people that may not be as familiar with you as I am, why don't you go ahead and introduce yourself? Tell everyone who you are and what you do.
Sure. So my name is Nicole D. Vick, Dr. Nicole D. Vick. Woo!
That's right.
I'm here in Los Angeles, California, public health professional of about 20 something years. I'm actually pretty close to retirement. I'm like, I think I'm going to retire as soon as I possibly can. My expertise, I would say, is local health departments and specifically workforce development. I really got interested in the public health workforce. And that's actually the focus of my dissertation. So I've taught for a number of years at a number of universities, both online and in person. And I just feel like I'm for real, like a public health advocate. It's not just a job to me, it's a way of being and sort of a way of seeing the world.
Oh, I love that. And that shines in everything for you. I mean, I follow you across social media and you just summed that up really well. I think this is amazing. And of course, we've had this conversation a long time ago, but I still want to hear about your journey to here because now we're going to fill in more gaps between the last conversation and this conversation. But when did you first learn about public health? I know you've got a really interesting story if you would share that. When did you first think about public health as a career?
I'm trying to remember what happened. It's been so long ago.
Oh, yeah.
I know I was a student worker. I remember being a student professional worker. I was a teen mom at the time. I'm like, well, I guess I need to figure out a job to help support my daughter, who actually now is 28 years old, which I'm like, wait a minute.
What?
When did that happen? And so I found a job at the health department and I was a student worker in the STD program. So they put me on the phones. I was answering questions for people, referring them to the public health centers, giving them condoms, all sorts of things. And so I was in a space with a whole bunch of health educators. And I was like, what do you do? Like, oh my gosh, this seems so exciting. And they were like, yeah, you have to have a master's degree in public health. And I was like, oh man, I don't want to go back to school, And I'll say here at this point, the importance of mentors, and especially for Black women in public health, the importance of Black women mentors. There was a woman, and she still works where I work to this day. She is a epidemiologist. And I was talking to her about going back to school, and I was like, I don't want to go back. That's 2 additional years. 2 years will pass anyway. Go back to school. Your salary will double. And she was right. So the value of the mentorship is important, and the value of listening. So some of us, we don't like to listen, but I learned early on, when people are talking to you that know more than you, pay attention and do what they say. So she's still, like I said, she's still there. I asked her about my doctorate program. She said, yep, go. And I was like, all right.
No pushback. Right. Oh, that is wonderful. And that's a great point. The value. I had a great mentor. I've had a series of mentors there in my life when the times I need them, but specifically for public health. I had a mentor in the earlier phases of that transition for me, and a Black woman she's in a position, she's just had a heart to just kind of be very encouraging with a light touch. And we kind of, I won't say we ever really disconnected. We just went different directions for a while. But I returned back to her the last couple of years before she retired. And she agreed to, I said, I need my mentor. And I just would go and sit with her every 2 weeks. We had a standing appointment. And I go to her office and we chat about whatever came up during that time. But, I value mentor. It's both the giving side of it, being the mentor, but also the receiving side of that. And there's so much to learn if we're willing to listen, like you say.
Absolutely. And I think that experience really shaped who I am as far as how I support, young folks coming up, or the advice that I give, or even when I was doing, being a professor adjunct, how I engage with those students, because my thought is, listen, I'm going to retire one day. You guys are going to have to be this next generation of public health leaders and innovators. And so whatever I can do to help you along that route, I'm going to do it. And so just by her being that, and she wasn't the only one, there were other Black women that I came across in my path that helped. It just helped me be a better mentor, or even just want to give back in some way.
Yeah, that's really strong. I like that. So you mentioned workforce development, but is there a particular population or cause or issue that you are most passionate about right now? Would that be it, or is there something else?
So when I first got interested in workforce development, it was what was really happening at the time was, I don't know if you remember, but it was like social determinants of health and health equity had become like this theme, right? Yes, we're focusing on these concepts. And I was excited about it. I understood it. Yes, let's do this. But at some point I was like, does the public health nurse understand the social determinants of health and what that means in her day-to-day, or his or her day-to-day work? Like, does the public health investigator or the community health worker, like, there's this idea that we're pushing, but like, what does it mean for folks? And so that's where the interest in the workforce kind of came in. I actually did a little bit of research on that and wrote up a article. We didn't publish it, but just that experience was really enlightening for me. And I think that's where, hey, how is the public health workforce? Are they okay? Like, how are we training them? So that's where the interest came. And of late, with the dissertation moving forward, it was really this idea of psychological safety. And I'll say at the time, I didn't really know, like, what is that? But what happened was I had a personal experience. I didn't know what to call it. I figured out finally that it was a situation where I was not psychologically safe. So what that means is I can't come to work and bring my whole self to work if I choose to or not. I cannot push back, ask questions. There's a sort of cost to doing that. I mean, there's this constant sort of interplay in my head about, do I say this or not? Do I do this or not? That can be very stressful. And I was like, I wonder if other Black people that work in local health departments in the United States feel psychologically safe. And what is the intersection between institutional racism and psychological safety? And so that's kind of where I ended up with my dissertation. And I will say that we have folks that are very passionate about the work. I feel like Black folk come into public health work passionate because they either have lived experience or they've witnessed something. And so we come in excited, and then something happens where we get sort of this feeling of dismay and sort of like, well, wait a minute, because we start to see things happening. And that's what I saw in my research, that folks were like, how come? Why does this happen this way? Or why do I get paid less than the person that does the same job as me? Or how come they only ask me to do Black people things because I'm the only Black person here? Like, there was these very weird things that were happening to these folks that I interviewed. And it was really, really interesting to see.
Yeah. Is your dissertation published somewhere, or is it like available for people to read or
I
review?
believe it's, what is it called? ProQuest, when you
Yes.
it's in that thing.
If you could share a link so we can add it to the show notes, I think that could be an interesting read for a lot of folks who
Yeah,
are thinking, listening to you going, "Ooh, I want to know more about that." So
absolutely.
we'll get that to the show notes. Okay, so let's talk a little bit. It's great. I love that, kind of bringing us everything that we have done shapes kind of where we are now. And a lot of it is like a retrospective view because we reflect and it makes sense to us. It didn't always make sense to me while I was going through it, but when I look back, a lot of things make sense. But talk to me a little bit more about what you're doing right now. And yeah, let's jump in there.
Sure. So I still have I say still, but I don't know if I was doing this when we first talked. I have a video podcast. It's called Nicole D Vick Live because we couldn't think of a better name at the time, but we'll be changing it soon. And it's really about social justice issues it's about issues in the Black community from a social justice public health lens. Because again, that's how I see everything. I don't see it any other way. And we talk about really important topics. I spent all of April talking about like what is happening in the industry of public health. What is going on? There's so much like, what?
Yeah.
Getting pulled back and like how that feels and sort of how we can sort of push through. Haha, push
Start
through,
the
right?
book. So is your video podcast, where is this? Is it on link?
It's on LinkedIn. It streams live on LinkedIn and YouTube and Instagram and Facebook. Every
Okay.
week, I try to go live. Sometimes I have to record, but I try to go live because I feel like it's a really good opportunity to connect with folks. I've had some really good guests come on and share their insights. So, one week it'll be Public Health Week or Minority Health Month, or, I'll be talking about relationships or parenting. And there's all these sorts of ideas and concepts that I feel like we need to be talking about, and it's important to really share. So, yeah, that's what it's been about. And like I said, I don't shy away from talking about, wait a minute, this institution is important. This institution of public health is important. We're in a bad space right now. Now, I have maybe controversial views about certain aspects of what's happening. And I did a video, I don't know if you saw it, but I said, I mean, if you understand the history of public health in this country and how it began, we are just defaulting back. We're doing a hard reset to factory settings. It's unfortunate, but that's what happens when something is built on a messed up foundation. You're going to default back to that. And I always tell people, people say, oh my gosh, the system is broken. It's not. It's acting as it was designed. The problem is we have to fix it. Now, I don't know what that means or how we fix it, but this actually may be the opportunity. Now it's being sort of stripped, right? Pulled back and taken apart. Maybe this is the opportunity for us to rethink on how to build it. But yeah, so I don't know. I feel like sometimes I have controversial thoughts about what's
Okay.
happening.
Yeah, we don't need to all think the same way. I think if we're ultimately, we want the same thing in public health. Those of us that are doing the work in public health, invested in this calling that, that's really a calling, right? So we ultimately want the same end result. We have different ideas about how to get there. And I think just like to your point earlier about listening, so you may say, well, yes, it's controversial. That's okay. I think that should be welcomed because we need to hear views that are not the norm, traditional, standard way we've always done things. That didn't serve us very well. This is a big record scratch moment. So now we need to be listening to some of those ideas that we, air quotes, were controversial, but now everything's on the table. So, and I just put that in the context of these folks, and I say those of us that are invested in public health, because some people outside of public health that have all these ideas, we're not really talking about that, especially if
Right.
they're trying to erase us and get rid. I'm talking about those of us that are in this industry trying to think about what we need to do next and how to make change. So I'm going to have
Yep.
to check out your podcast.
Yeah.
I catch videos here and there, but I think to know that it's as a series is I didn't realize that, so I'll make sure
Yeah.
to be a little bit more intentional.
And see, I have to do
Um,
better at that. You're good at that. I have to get better at that. Like, hey, so people know.
well, you see, I did say when we were celebrating episode 400, I made it really clear, like the whole team we have. So this is not just me, but a whole lot of us behind the scenes keeping this flowing. So I love that we have more variety and folks bringing their message and their views in
Yep.
public health. Okay, so this is, I have to ask you, we can talk as much or as little as you would like, but I've been following your story and we've talked about some of the exciting, great things that you've been doing, the doctorate, the journey, all around that. Remember when you first announced it and I watched, I like how you shared that with us. We got to like follow you and then you announced, it's complete, I'm Dr. Vick. So that was wonderful. But you also shared a tragedy very visibly. And I just am, so we're recording this at the end of April 2025. And a couple of months ago, I spent about 3 weeks, almost a full month working in California. And I had a lot of events. I had some VIP days with some certain clients. And I had events that we hosted. And then I sprinkled in a couple of meetups with people that are there that I, engage with like you and hadn't been able to meet with in person yet. And I reached out to you to try to see if we could get together. And you were, that's when I realized that you were kind of still struggling. You were in physical therapy, you weren't driving, so we weren't able to get together. But what happened?
Whew, well, literally 1 month to the day after graduation. So May 8th, I'm like, yeah, got the cap and gown on. Woo! My daughter's with me because she had been with me through the whole journey. So really exciting time, like the highest of the highs, right? Yeah.
Yeah.
1 month to the day in my home. You know us type A's. We, oh, I can do this. I can do that. I'm trying to do something. Something with a large mirror. I was trying to do, and got off balance. And I don't know if you've experienced this, but if you know you're about to fall, everything is in slow motion. First of all, like the Matrix, like with slow mo. And I'm like, oh my God. So I know in my head, I'm about to fall. It's in slow motion. I'm looking around for something to grab. There's nothing. I fall. Ankle kind of does a thing. And I'm like, I don't think that was a good thing. Stood up. It felt like rubber. Went to the ER. Ankle was broken in 3 places. And I was like, you know what?
You did it good. It was excellent. You didn't just get like a fracture. You got like a real break in multiple places.
One of the doctors said, you broke this thing real good. I said, well, I tend to do things really well. So I understand. Why not break it really well? Why not?
That,
And of course, it was my right foot, the foot that I drive with.
yeah.
So
Oh my
yeah, it
goodness.
was a lot. And I think what I'll say is the part that made it worse was now, I'm in public health. So that's a healthcare adjacent sort of industry. I understand. I work with nurses all the time. It took 3 months to get my ankle fixed. It was a mess.
3 months? Why?
Mm.
Why would it take that long for you to get the care you needed?
It wasn't supposed to. It shouldn't have. I feel like my insurance company was fine. I won't fault them per se, but when you have an HMO, you have to select a medical group or something like that. And I think I just happened to have a crappy medical group because they sent me. So the ankle was broken on a Saturday. They made me go to my primary care on a Monday. I had to go in. I'm like, I just told you people that I can't drive and I can't get around. I had to crawl down my stairs to get to the doctor for him to say, oh, yeah, it's broken. Here's a referral. So I go from one orthopedic surgeon to another. I went to 3 and they were like, yeah, I can't help you. Go to the emergency room. Yeah, they'll take care of it there. It was just a really weird situation. And so I called the bluff and went to the emergency room and they were looking at me like, why are you here? This is not an emergency. Spent 3 days in the hospital only to be sent back home in an ambulance. They were like, we can't help you. And so it was just a really weird space. And again, my public health brain was always thinking, what if I didn't speak English? What if I was neurodivergent? What if I didn't have people with me to advocate for me? Where would I be? Where? I mean, I was already, 3 months is horrible, but I feel like it would have been even worse. And so I just couldn't help but think of those things and kind of focus on it like, wow, I have a doctorate degree in an industry that's adjacent to healthcare, and I couldn't figure this out.
Mm.
Yeah.
I am at a loss for words, really, because I mean, to your point, what if you did not have the lens to view this that you do have? And how many other people have been in a similar type of situation? And then what are you supposed to do? 3 months? It's starting to heal in some way, not appropriately, but so then the treatment is now gonna be even further complicated by that.
Exactly. And one of the things that I always thought, so I had that public health frame of mind, but I also said to myself, it's not lost on me that I'm a fat Black woman trying to navigate this space as well. And is there some bias there? Right. So those are all these public health things that we hear about and know about. But yes, thank goodness I had people to advocate. My mom was so mad. She called the health insurance company. She called my primary care physician. I'm like, Mama, but it's like, again, when they know there's other people behind you, they tend to act a little bit better. But what happened was ultimately, I forgot to close the loop. So when I came back from the hospital, they just kind of dropped me back off at at my house with
That's crazy right there by itself.
they just dropped me back off. I didn't have my splint anymore because they had taken it off. So I didn't have nothing. So I'm just like foot just out. I called the insurance company back. I'm like, hello, what's going on? And even the operator was like, I am so sorry. This isn't right. She said, let's switch your medical group. So she switched me from one group to, and I'll name this group Cedar Sinai. And so I don't know if anybody's familiar with Los Angeles. Cedar Sinai is like top of the top, right? I get to Cedar Sinai. I see the orthopedic surgeon on a Thursday, and I had a surgery date on Friday. So you see the difference in care? Right? The next day, the lady calls here, your surgery is on September 20th. I said, oh, wow. And even he was like, what happened? What's going on? And he's like, I can fix it. But he was like, why does it take so long? I don't know.
Wow. So
Yeah.
this is a living, I wanna say public health story. I wanna say public health nightmare, but
Yes.
there's so many things here that speak to every bit of everything we talk about in public health, all the things that we try to prevent. You talking about bias. Whew,
It's a lot. It's
it
so
is
many
a lot.
things. So we talking about writing another book that, people keep telling me, is this your next book? I'm like, I just
Yeah.
can't even really sit down and even process it. But I agree with you. There's so many layers. So for one, it's the personal experience, the lessons I learned just about myself and what I can and can't do. But then there's that public health part. There's that healthcare part. There's so much that I could really, so maybe it is the next book. I don't know, but it's a lot. One thing you said too, people get frustrated when they don't understand how to navigate healthcare. And maybe in my case, maybe by the time they got to that third doctor, they would just say, forget it. And they just decide to buy a wheelchair and they just live like that for the rest of their lives. And that was one of my questions. I was talking to my brother. I said, so what's the answer? Nobody's giving me an answer. I'm just going to be like this until I die. This doesn't make sense. No one's talking to me about, well, Nicole, and this is going to sound like, Nicole, you really reaching. But the reality, I said, amputate my foot and give me a prosthetic so I can at least walk. Like, nobody's saying, it was just like, I can't help you. Okay, well,
Yeah. Yeah, there's no the possibilities, nothing to look forward to, nothing.
it was just
That is
weird.
yeah. Mm. I
Yeah.
am so sorry that you had to go through that. I hope that you will find some space to process and see what you can sift out of the experience, and if you decide to write about it, then come back on the podcast and talk to us about that too, because I'd love to be able to, read that and to help promote that story and lessons from that, but this is something that does not ever need to be, experienced. But, we know that the bias, the stressors, the care, the disjointed journey of the public health system, because they're interlocked at this point. That you can't separate the paths out. We know these exist. It's just shocking to be experiencing the thing that you work hard to prevent and for people not to be dealing with.
Right. Absolutely. I was like, wow. Okay. Well.
And you have such just a natural sense of humor and bubbly, and so the entire time, like, you're expressing your frustration, you're talking about it, but you do it with humor, and I guess sometimes we have to laugh our way through. It's laughing better than crying, right?
Yeah. Yeah. Again, that whole concept of pushing through is like, I mean, there's no choice. I remember the ambulance driver, I said, this is how I need to get in the house, put the stretcher this way, da, da, da. I'm directing him. He was like, you're so strong. I said, I have no choice. I live alone. What am I do? Sit here and cry? And I did cry, yes.
Yeah,
But you
right.
understand what I mean? It's like, I have to get through this. I have to figure this out. I have to. Like, there's nobody. But I will say this, the amount of support that I received was, I mean, overwhelming. There are people that I met on LinkedIn that I did not know prior, literally showed up for me. There's a guy, took me to all my medical appointments because I couldn't drive. And I literally met him on LinkedIn maybe right after I graduated. So I didn't even know him that long. And he was like, just tell me when, what time, let's go. And he would come get me, put the wheelchair in the car, get me in there and take me. So I will say the village really showed up for me. And I hope that I will be able to show back up for the village whenever I'm needed. I'm like, whatever you want from me, I got it. Cause now I can drive, I can help you out. So I think that's the other side of it too, that community. I'm just so blessed because my daughter is not here. She's out of state. My brother works a lot, so he can't always be here. And people really did show up. So, yeah.
Well, I'm gonna roll that back a little bit because I think people showed up for you because you were showing up for people way before your accident. You planted those seeds. That's how you are. So it was easy for people to show up for you when you needed it. So it's beautiful to point that out because I think, as a public health network and community of people, that's how we are. And I
Yes.
like to believe that, that's the genuine core part of people, whether they're in
Yes.
public health. I like to believe that. So when I hear stories like that, it reinforces my belief and my hope in humanity, as a people. That's how we should be. And I think that's kind of how we are at our core. So that's a good thing that, emerged from that, the opportunity that you had people around you that were ready to show up for you.
Yeah. I'm so grateful.
Nice. Okay. So, you and I can talk about stuff all day long and keep going. Thank you for really opening up and being willing to share that too, even without having like a full solution to the whole thing, but just kind of putting it out there. And it's something to dissect and process and just like a reminder for people. And I think it's sometimes there's a power in being vulnerable and sharing your experience. So thank you for doing that. Let's see. I had a whole lot of questions I wanted to ask you. I'm going to ask one more and then we'll wrap up
Okay.
because you are such a great inspiration, just being who you are and the way you show up. You're an educator at your core. For people that are listening to this conversation, they may be in any scenario, I'm just going to ask, is there any bit of advice that you would share? It may be professional advice, career-related advice, just navigating public health right now as professionals, or just any, tip that you could share in any of those kind of umbrella topics for our listeners.
Yeah, I think one of the things that I've been telling people right now, because it can feel overwhelming in this climate, whether you're in the public health space or not, right? I think all of us are feeling something based on everything that's going on, is to really find your power, your strength, your lane, the thing that you know how to do well and leverage that. Because I think a lot of times we feel helpless, like, I don't know what to do. And it's like, yes, you do, because the thing that you love to do all the time that you're good at, that's the thing that you should be doing. So, there's some people that will protest, right? Because that's their strength. They understand the whole concept of that. A lot of us cannot do that. They're no, scared or whatever the issues are. But guess what I'm going to do? I like to talk. I have a video podcast. I'm going to talk about what happened with my ankle. I'm going to talk about what I see happening in the public health space. Some people may write, so I'm going to write. So I think people just need to figure out what their lane is, their strength is, and operate in that. They don't have to do stuff that they're not comfortable doing. Do what you know to do and do it well, and use that as your leverage point to be sort of an activist or to get the word out. I think that's the thing, because I think sometimes we can see something happening and it can feel so overwhelming. It's like, oh, I'm just going to mind my business and stay in my lane. It's like, we can't actually afford to do that in this space right now. We can't afford to just let things happen. We have to speak up, but you can do it in the lane that you have chosen and operate in that way.
I think that's wonderful advice. There's a lot. And it's true that I remember feeling like, why, the first couple of weeks with the first round of craziness that floated out, I remember thinking like, oh, this is out of control. Like, well, why should I even bother writing to my local representative? This is just done. There's a feeling of it's not going to matter. And I've heard it from others and I felt it myself as the waves continued, like, oh, it's almost like we just got to sink back in and just like hunker down and ride the wave, which in some way, since we have to be ready for that, but reminding us to show up the way that we feel like is aligned for us uniquely and the way that we have done and what we do, and continue to show up because, it's important and it's powerful. So that's a great bit of advice and reminder for some people, first time they're hearing something that they can maybe sink their teeth into and hold on to. So thank you. Thank you for that. This has been great. Thank you so much. We've had to reschedule a few times and all that to get you back on the calendar, but I am so grateful to you for taking time to come and chat with us and share updates. And I wish you all the best as you continue to heal on this journey. And what are next steps? Are you still in physical therapy or are you released from physical therapy?
I'm still in physical therapy. I use a walker to get around. I'm getting better with that. Right now, they're trying to build the strength up in my calf muscle on the right hand, on the affected side so that I can support my body weight and move around. But I'm doing really well. And they did clear me to drive. So I was like, let's go. Where are we going? I've been driving around. I've been really excited about that. So I'm definitely gaining back my mobility. I'm starting to feel more and more like myself. I think that's something else people forget. Like when something like this happens and your mobility is sort of impacted, you do kind of, because you're in survival mode at that point. And so now I'm starting to feel like myself. I'm starting to get dressed and put clothes on. I wore jeans like for the first time a couple weeks ago. So, I'm starting to kind of get back into the swing of things and I'm really excited.
Yeah, that's just great to hear. Well, next time I'm in California, we'll see if we can't get together.
For sure.
It would be absolutely wonderful. We can have lunch or dinner or something like that. I'm planning to be back there soon, so we'll have to make sure we keep in touch. All right, Nicole, you take care and we will talk again soon. I hope you enjoyed that conversation as much as we did. It was so much fun to catch up with her. I encourage you to connect with Dr. Vick and learn more about her video podcast, her books, and other work that she's doing. You can find the links to the previous episode with her and all of the links to connect with her on the show notes page. The show notes page for this episode, which is episode 408, can be found at phecpodcast.com. Once you're there, just navigate to episode 408 to find the show notes. Now, one more thing before you go. Remember to download the new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.